Namaste. While dealing with autism spectrum disorders, we have to know 2-3 things first. The very first thing is what is happening in your kid. Second thing is what will be the cause for this. Third one, how to deal with that. So, the first thing I would like to explain you that what is happening in the kid. Most of the time, we in Ayurveda we will say that there are 3 qualities of mind. The very first thing is Dhi, Dhriti and Smriti. In Dhi, it's nothing but the intellectual thoughts or the brilliance of the kid. The third one is Smriti, that is nothing but the memory. So, fortunately, in autism spectrum disorders, the kids will be 100% perfect in these 2 things, means intellect as well as memory. But where they are lacking, they should know the Dhriti concept, in the sense where we should put or implement this intellect as well as the memory. There they are lagging. Or else we can say many have gone to almost all the sense organ analysis, ear, tongue, skin, etc. But we don't find any defect in sensory aspect, but only thing is the sensory organs are perfect, but the sensory organ receptors in the brain is lagging. So, the link between sense organ and the sense organ centers in the brain, that receptors should work better, and the impulse passage from the sense organ to the receptors, that should be perfect. So, the second thing is the cause. So, I have told about the condition what is happening. So, for that we have to enhance the Dhriti concept, that brain regeneration should happen. Before saying about the treatment aspect, I would like to explain you about the cause. Maybe nobody have told you why this happened. Many have put this into genetical disorder, but I don't say. In my more than 13 years of experience, I can say it as 95% of the kids are, the condition is not genetical, it's purely after birth only. Even the parents are saying that 95% of the parents are saying that till 1.5 years of age, the kids were talking like almost normal kids, they were interacting, they are having the proper eye contact, everything, but immediately something happened. Why this happened? That you should know. For explaining the cause for the condition, the very first thing that you should know that what our gut is, means our GI tract, gastrointestinal tract, it's having trillions of microbes in our gastrointestinal tract from the mouth to the intestine. In that microbes, literally we can divide those microbes into 2. Very first thing is good microbes as well as bad microbes. That good microbes are the one which is helping us to enhance or that immune boosters, that we can say it as that good microbes. Bad microbes, as the name says, it is bad, but still both these microbes are necessary for our gut flora. So, in that microbiota, if the good microbes, the number of good microbes are less in our GI tract, it means that either your immune level will be less, or we can say that if any foreign body attack to our body, the body will not resist towards that. It will be harmful for our body as well as our GI tract, as well as the rule says, there is a relation between gut and brain. As the gut health is the brain health. So, if it affects the gut, it will affect the brain. So, what is mean by this foreign body? It can be correlated to either some synthetic kind of preservatives or added flavors, synthetic whatever the other items, colors, etc. comes under foreign body. Along with that, some other things, heavy antibiotic use or any heavy synthetic drugs or even some vaccinations are causing these kind of disorders in the kid, as per my experience. Out of that foreign bodies, there is a top grade of importance to some of the vaccines such as MMR and other things. Why it is not causing for every kid? That's also, it's an alarming sign that if the gut flora is not proper while taking these kind of antibiotic or any kind of vaccines, our gut will be affected, in turn the brain will be affected. So the thing is, before taking vaccination, we should know whether the gut functioning or gut metabolism is proper or not. Otherwise, that will harm the brain. This is what, as per my experience, the cause is. So the cause is something which will be related to gut microbiota. That's why the parents are saying that till in the 18th month of age, the kids were better, and after that immediately she or he got a fever, she was admitted or he was admitted in the hospital, heavy synthetic drugs has to be given. After that this condition happened, or some vaccinations, even after vaccination this condition happened. So these are rare conditions, but we have to be alert, because in the present scenario 1 kid out of 60 kids are autistic in nature. So this is the cause, some derangement in the gut microbiota. So this derangement, if we find out, we have to treat that. So that is why, as per my treatment protocol, the treatment has to be given to the gut metabolism. The gut metabolism has to be corrected before doing any kind of therapies or any kind of other medications to the brain. That's why in many of my talks, the people are saying that there is no medication for autism. Yeah, you are true, but there is no medication for autism, but there is medication for the cause for autism. That's what Ayurveda is treating. So in our hospital, what we are doing is we have integrated the goodness from Ayurveda, the goodness from the lifestyle, and the goodness from the therapies. So first importance what we have to give is, the first importance should be given to the food that we are taking, because we say that food should act as a medicine. That is why even all the psychologists and psychiatrists prefer that GFCF diet. What is GFCF? Gluten free, casein free diet. Almost everybody will be knowing that GFCF diet. Why we have to follow GFCF diet? That also you should know. As I told, there is some impairment in the gut metabolism and the assimilation and absorption in the body. Whatever the undigested food, that will act as a toxin in our body. As per Ayurveda, we say it as ama. So if the food is not digested properly, it will act as a foreign body as well as a toxin in our body. So it will in turn cause temper tantrums in the kids, that you may be knowing. After giving milk or any wheat products, kids will show some temper tantrums. That everybody knows. But why it happens? It's nothing because the casein or milk is having alpha protein in that. That protein will not be digested. That protein metabolism is impaired in the kid. Some kids will be having carbohydrate metabolism error. Some kids will be having protein metabolism error. So you have to find out which is the error in the kid. Accordingly, we have to treat the gut metabolism. That's why I told the treatment is purely based on gut brain theory. So we are correcting the gut by improving the digestion and assimilation and absorption, so that the brain will function better than before. For example, some kids are expressing some symptoms like hyperactivity. What is hyperactivity? We see hyperactivity in kids, we are correlating it that to Rajoguna in the mind. Our mind will be having 3 gunas. It's 3 of them are gunas, means qualities only. But if it is high in nature, more than the normal level, that will be considered as an error. So most of the kids are having Rajoguna in the mind. Why Rajoguna, or what is the qualities of Rajoguna? If our mind is Rajoguna in nature, we will be having more of moving nature, we will have arrogancy, or we will have that craving nature, we will have hyperactivity. All those qualities can be correlated to Rajoguna of the mind. We have to make the kit to Rajoguna to Sattoguna. You can just Google it, all those names. What is Rajoguna? What is Sattoguna? Sattoguna means nothing but that harmonious nature, calmness, that acceptiveness or receptiveness can be correlated to Sattoguna. So, ultimately we have to change the kids Rajoguna Yukta, that Rajoguna mind to Sattoguna. Some kids will be having Tamoguna also, means lethargic feeling, that immobility nature, they will be idle, they will be will not be expressive that much. That will be Tamoguna. That is very much rare in autism spectrum disorders. The Rajoguna is more in autism spectrum disorders. So what we do is we will change this Rajoguna to Sattoguna. How it is changing? Only by proper food. Food should be sattvic in nature. So commonly I used to say that you should take care of the quality, quantity and timing of food. That is much important while treating these ASD disorders. What we do is we will correct the biological clock, in the sense what time the kids should get up, what time the breakfast should be, what time the lunch, what time the dinner, what time the kids should go for sleep. By correcting this biological clock itself, the sleep pattern and the brain thoughts will be getting better. Along with that, we will get sattvic kind of food. So this should be the routine for the kid. So after putting this biological clock correction, what happens is the sitting tolerance will be better, that acceptiveness will be better, the awareness of the kid will be far better, even eye contact will be better. Along with that, we will do the gut correction also. So after making the mind to sattvic mind, if we put the kid to the therapies, you just think how much effective it will be. Because if the kids are restless and moving nature, even if you take him to speech therapy or behavioral therapy or whatever therapies that you take, that will not give 100% result. That may give result for 30 to 40%. But if you want to get 100% effect or the result of that speech therapy and other therapies, the mind should be receptive in nature. For that purpose, we have to put them to proper biological clock correction. The second thing, many are complaining about the deficiencies in the kids. Vitamin D deficiency is most common in the kid. For that also, I am just saying about the gut metabolism should be corrected. Why? Because the digestion may be happening in the kid, but the assimilation part and absorption part will be damaged. That is why we will supplement vitamin D from outside, but it's not a proper way to deal with the case. The body itself should absorb the vitamin D, whatever the food that we are taking. So that also will be corrected with the baseline of gut correction. The third one, many are saying that sensory issues, that also will be corrected with the proper digestion and other things. Once we correct this gut metabolism, we can remove the kid from GFCF diet. That's what our experience is. Why? Because right now what is happening is many are following GFCF diet and many diet regulations for 2 or 3 years. But even if you are restricting that diet for 2 or 3 years, even if you start in the next day, again the temper tantrums are happening. That only because you have not treated the basic cause, means gut metabolism correction. Gut microbiota should be corrected properly. That is why in Western countries they used to give probiotics and prebiotics. It's nothing but that they are giving good bacteria towards to the gut for the proper functioning. That is also not fully satisfied. Why? Because we are helping from outside. By proper gut metabolism correction, what Ayurvedic treatment is, body itself will maintain that. If you are helping from outside, there is a limitation. After stopping that, again that gut may be impaired. So proper gut correction is needed. Metabolism should be corrected, so that at any point of time we can add all kind of food like milk, wheat, etc. slowly we can add up to the diet. The other thing is, we have to give much attention towards the kid. Ultimately, we have to give primary importance to the diet or the food, ahara. Second importance to medication. Medication, it's meant for the gut correction and regeneration in the brain, not to subside or diminish the qualities. In the sense, hyperactivity is there, you have to make them calm. That is not the way to give the medication. Medication should be given for any long term use. We have to withdraw the medication. The third importance should be given to therapies. These are the things that you have to keep in your mind for your priority purpose. And in our treatment module, we have included other things also, like we will be making the kids more what we say related to the nature, because nature is having such a healing capacity when we expose the kids to the nature. So mostly we have to make them expose or make them a rapport with the nature. The other thing, some kind of marma and yoga therapy is having its own effect or positive effect. Last but not the least, it's a main thing, art of positive parenting. What a parent should say in the home, or what should be the atmosphere in the home, what should be the rapport between father and mother and other family members, what should be their attitude, all those things should be corrected enough, because we think that the kids are not hearing the things, but they are highly intelligent, they are having heavy or pointed out memory also. So just keep this in mind. So it's a combined effort of a health worker or a doctor, the parent, the neighbors or other family members, and those who are involving with the kid. So it's a combined effort. A doctor will be only a guide. The parent will be the exact doctor in treating the kid. We will just explain or guide you where you should go further. So think your logic and go ahead. It can be reversible. It can be reversible. 100% we can reverse the kid. Don't be depressed. We are here to help you. At any cost, we should bring them to the mainstream. Namaste.